Good morning, Claudia. I'm here with Tavia Evans, Dr. Tavia Evans. Again, we've interviewed you several times here on Great Day Live at a lot of different CenterWell locations, but you are the area medical director. So tell us about your role with CenterWell.
So my role is that I oversee the 5 clinics in Kentucky that are assigned to me in Lexington and in Louisville. And soon we will have a 4th center here in Louisville on North Dixie.
Yeah, that is so exciting. I feel like last year we hit on all of the locations, and it's so great to see that you guys are expanding here too. And so I've been hearing throughout the morning about CenterWell's model. It's different than regular care providers. So how do you work with the doctors across the state to ensure that you're delivering that primary care for seniors?
Because we're teaching them a new model of care. When you look at the average physician or nurse practitioner, they get about 7 minutes with a patient.
Wow.
Here at CenterWell, we get anywhere from 40 minutes to an hour. So that kind of time lends to a better experience for patients, a better experience for providers. It gives satisfaction to us as providers. We love our jobs because we get to do the things we were trained to do, which is help people understand their health care at a deeper level. It helps us forge relationships that we don't always have time to forge when we spend that kind of time with them. So that's the part I love the most.
Yeah, really relationship building and giving that quality care. And so I'm seeing here that you're one of few who really study diabetes. And I know that is a rising concern, especially with the older generation. So how can you treat that, and what are some signs to look out for?
All right, well, diabetes, we call it the great iceberg. More people are diabetic than they realize. So under the surface, there are a lot more people who are struggling. And it requires education. So if you have time to teach, you have time to help people change their lifestyle first and foremost. Seniors become less active, so they don't burn sugar at the rate, but they may maintain that diet that's high in sugar. And Americans love a high sugar diet, believe it or not. Think about our country cooking and our Sunday dinners and our holidays. It's full of sugar. So we end up moving less, burning less sugar. And so now I have to teach you about how to change your plate a little bit. How do I help you move a little bit more in a way that's appropriate for you and your health at the time, because seniors have challenges sometimes. So how do we work around that? And so having time to solve for that actually helps.
It is really, really interesting to see that even later in life, you still have to make those lifestyle changes day in and day out. And it's so great that we have resources like CenterWell to do that. But, last question here, what is personally your most meaningful part of working at CenterWell?
I think it's the relationships. It really is. And we can help in ways that I think other places don't have the opportunity. We have resource coordinators. We've helped people get assistance on things like getting a furnace or helping them get their furnace fixed.
Oh, wow.
We help with social determinants of health like ride service, food insecurity. We help tie them to a community resource. So it ends up circling. All these things are on our patients that is really great so that they can get the help they need in their later years. So they live full lives and have good quality of life. I think that's the most important thing. So for me, I enjoy that part of the job because we really get to touch people's lives.
Yeah, putting the senior in the center and building around it.
Oh, yes. The name says it all, doesn't it?
Yes, it does. Well, Tavia, it's always a pleasure to talk to you, so thank you so much for taking the time.
Thank you.
And so here at their West Louisville location, they're actually doing a big partnership day just ahead in their activity room. So coming up next, we're going to learn a little bit more on what they have planned today. Back to you, Claudia.